There are grave concerns for Victorians in residential disability care, with fears the sector is headed for a COVID-19 crisis like that seen in aged care. The Commonwealth has declined the Victorian government's request to join a rapid response group into the sector. There are more than 80 active cases of coronavirus in Victorian disability care, and advocates say staff are still working across multiple facilities, something that has fuelled aged care outbreaks. For more, I'm joined by Kevin Stone, who's the Chief Executive of the Victorian Advocacy League for Individuals with Disability. Kevin Stone, thank you so much for your time. What are the biggest concerns for the sector right now?
Look, the biggest concern is the alarm bells are ringing, and we're hoping that the right people are hearing, but it just doesn't seem to be the case. The Commonwealth not coming to the party on the rapid response group is unforgivable. They must take responsibility. They cannot walk away from this. The numbers may be low still in Victoria's disability homes, but all the signs are there. All the same conditions that prevail in aged care facilities exist within our group home system for people with disability. We cannot walk away from this and think that everything's going to fix it itself. We have to take the precautions right now. And what we need to see is a joined up approach, a joint planning committee to actually respond in a collaborative, cooperative way. I am completely over the buck passing that exists in this system. Now is not the time for political games.
You're concerned that disability care could head down the same path as aged care and see big outbreaks in the sector. The NDIS Minister Stuart Robert has said that right now, because of the significant support from the Commonwealth, an NDIS participant is 4 times less likely to contract COVID-19 than the Victorian general public.
Well, that's very nice for him to say. My son lives in a group home. He's supported by a group of wonderful staff. But staff in group homes across the state have families of their own. They also get sick. They need leave. They need to be looked after. They need not to be forced to have to work across more than one site, because we know that this disease is carried by mobility, by human mobility, and we have to actually cut that down. And unless services are actually funded adequately, properly, to be able to keep staff working in one site rather than having to work across multiple sites, then we are headed for the same disaster. What is so hard to understand about that? I don't get it. The Commonwealth Government came to the party with a joint response to the aged care issue and have made that facility available to aged care services. Aren't people with disability good enough? Don't they deserve to be Australians? This idea that they are just Victorians and the Victorian government should carry it all, this is just outrageous. They need to be at the table. They need to be taking joint responsibility for responding to the issues here. They need to be ensuring that staff have access to pandemic leave. They need to make sure that services are adequately funded to keep staff in one place so that staff aren't forced to go off and work in different places. They need to see that all staff are trained properly in the use of PPE and masks.
And what is that training like? Is that training adequate?
No, it is not adequate. I mean, and it's provided in a number of different ways. Last week we heard about some video resources that are going to be made available to staff. Well, that's wonderful. That is, I don't mean to be cynical about it, but that's wonderful. But the truth is, to actually train people in these techniques, you actually need people there taking them through it, making sure they're actually really getting it. There was a study done in Melbourne not too long ago of staff in the healthcare sector, where about 43% of people who went through that actually demonstrate, and these are healthcare workers, mind you, demonstrated that they didn't actually understand a lot of the procedures that were required. Now, if healthcare workers don't get it, the disability support workforce is not going to get it, I can tell you, because they don't have that same level of training. We need to see a much more intensive approach,
So you want to see workers limited to just the one group home. If you have workers who at the moment are working across multiple homes, are you not going to suffer from a shortage of workers?
Well, that's the other thing that needs to be really considered here. We need a surge capacity workforce. We need to see governments of both at both levels kicking in and making sure that there is a team of surge staff available to come in where there is infections and to be able to relieve staff and to work alongside staff to make sure that there is a team that is really high level trained that can come in and support existing staff, take that pressure off them. But services also need the capacity to bring in, staff from other areas. There needs to, and this is a logistical. I'm not pretending it's easy. How it's just obviously it's not. But
Because
it'll be a lot easier if
for
they actually
people with
sat down and thought about it and planned properly.
Because for people with a disability, it's not a homogenous experience, is it? Different people have different wide-ranging needs based on their disability.
Absolutely. People with disability, like the rest of the population, are unique individuals, and they all have their varying levels of support. But the fact that there are around 6,500 people with disability who live in around 800 group homes in this state, they are there because they need support, and many of them need support for the very sorts of things that we're talking about here: support for hygiene, support for social distancing. They need that support, and their staff, they need support. They need to be recognised for the work that they do. We hear a lot about, the heroes that in the workforce of the aged care. I can tell you, I meet heroes every second day, probably every day, who are working at the front line in disability services, and they feel that they are being treated as second-class workers. They need to be valued in this. They need governments to say, yep, we'll get behind you, we'll support you, we'll look after you so that you can look after the people that you support. At the moment, I'm afraid they are being used yet again as political pawns.
Do we know the numbers of people with a disability who've died from COVID-19 in Australia, or you might know in Victoria?
In Victoria, there are 2 people who've died as a result of COVID who are in group homes. I can only confirm, I believe there's only 1 person with a disability. I think the other was a staff member. We have unconfirmed reports of a 3rd. That has been part of the issue too, is the transparency of the figures, getting access to the proper data. That's starting to come through now, thankfully.
So, Kevin Stone, what's the next steps here?
Look, I really think that it is in the federal government's court to tell its representatives to sit down with the state in a rapid response group with shared responsibility for planning, for a crisis response, and to both equally commit to the heavy lifting here. I think the minister has said that they support the rapid response group and send representatives. Not good enough. Not good enough. You need to be there and be absolutely committed to making this work, to doing the work, to doing the heavy lifting that's required, and to look at. And there are massive lessons here. Victoria is having its share of problems right now, and we have to make sure that the lessons are learnt and that state governments across this country are heeding those lessons now, making sure they're looking after the workforce, making sure there's proper training, making sure they do proper contingency planning, all of these things. And it's certainly not too late for Victoria. We're only, as I say, the numbers are quite low, but we've certainly been looking at the experience overseas, and people with disability living in these types of situations in group homes have been highly susceptible to this terrible disease. And
Kevin
we need to
Stone.
heed those lessons before it's too late.
Thank you so much for your time, Kevin Stone, speaking to us from Geelong in Victoria.
Thank you.